Hi, I'm Shauna Bradshaw, Dr. Mom HD, and welcome once again. So today what we're going to talk about is a common childhood disorder that a lot of kids do get, and it is called impetigo. Now, how do you get impetigo? Well, basically kids contract this when it's poor hygiene. So when you got little ones that are constantly playing out there, learning how to toilet train, that sort of thing, you've got to encourage them to wash their hands. And if they don't, like most kids don't, then this is how you can actually get a disease like this. The disease itself is actually a bacterial infection. So we have bacteria on our skin, but this generally happens. It can happen when there isn't a cut or there is a cut. It doesn't really matter. But impetigo is a bacterial infection. So it's a staph infection or a strep infection. So it's either staphylococcus or streptococcus. So bacterial infections are the only way that this is occurring. It is highly contagious, and what happens, it tends to happen in just like a small little blister that will appear on the face, probably around the nose area or the mouth area. And what the child is going to then experience is the blister itself can be painful. So then what they're going to do is they're going to scratch it, and this is how it can spread. So it can either be a rash or a blister that starts up with the child scratching it because it's painful and it's itchy. So when you get the blister, if you pop it, there's fluid that oozes out. That fluid is contagious, and that's what you have to try and prevent. So you don't want cross-contamination and giving it to other family members. So what you're going to need to do is basically you're going to have to make sure that your child has a separate face cloth, separate wash towel, anything that you're using. Never share family stuff during this time, such as like even if it's a teen that could possibly get impetigo, rarely does that happen. Razors, face creams, anything like that. Any lotions, anything like that. You don't want to share any of this. So every family member gets their own bath towel and their own face cloth. The other thing that you have to remember is that impetigo is going to be a slow healer, but it will rarely leave scars. So as much as those blisters look painful and look awful, and yes, the child is scratching, you don't have to worry about that so much. So how would a doctor treat this? A doctor would actually treat this, a medical doctor would treat this with an antibiotic, because it is a bacterial infection, so it's going to be an antibiotic. Generally, it's pretty mild, so they'll just do an antibiotic cream on the face. If it gets to be more of a severe infection and it's spreading in mass quantities, then they'll probably do oral antibiotics. How is it treated homeopathically? Considering that there are so many remedies out there, taking the individual symptoms for a homeopath is very, very important. And is it definitely doable? Yes. I've treated impetigo many times with homeopathic remedies. And of course, each prescription seems to be different because it does depend upon the child that I am seeing. So each prescription is going to be based on the child, when it started, what we're left with, is there anything else that's going on with this child. So yes, it can be treated. During this time, though, you will be asked to stay home from school, because if you have impetigo or daycare, nursery, whatever the case may be, kindergarten, you're going to have to stay home because it is definitely contagious, and the last thing you want is to spread this to everybody else in that classroom. So here's a few tips that you can use. Remember to not share face cloths, not share bath towels, make sure your children are washing your hands, and hopefully you can avoid getting some of these common childhood diseases such as impetigo. And I hope you found this helpful. If you did, please follow me on Twitter and like me on Facebook, or shoot me off an email. I'm always looking forward to listening to what you have to say. I am Shauna Bradshaw, once again, Dr. Mom HD. Follow me, and I look forward to it. Take care for now. Bye.